Mr. Speaker, before we can even get to the substance of the new COVID-19 measures that the Premier announced yesterday, he owes Albertans some answers. For 12 whole days, the Premier vanished off the face of the earth while cases exploded, while pressure on the health system spiked, and while people worried about their economic security. While other leaders addressed their citizens, yes, even by video chat if necessary, this Premier went dark for 12 days. Premier, why didn't Albertans hear from you? Where were you?
Great question. I'm certain that the Leader of the Opposition wouldn't be referring to the presence or the absence of the Premier. Certainly, and sounded a lot like that. The Honourable Premier has the call.
Yes, Mr. Speaker, I was at home following the public health requirements to self-isolate, having been in close contact of somebody who had tested positive. Mr. Speaker, I note that in the spring and summer, the Leader of the NDP attacked me for having done too many news conferences and being too involved in the public response of the government to COVID. So what we have is, Mr. Speaker, just an NDP that swings it at every single pitch, that attacks on everything regardless of the truth. It's slightly pathetic.
The Leader of the Official Opposition.
He had time for a UCP AGM. He did not have time to address Albertans during a critical period, like when Alberta averaged 1,200 cases per day over the last week, surpassing 10,000 active cases. Our tests showing an 8.3% positivity rate. Fatalities increasing. Last week alone, we lost 20 people in one day. The fact is, it was clear well over a week ago that the Premier's wait-and-see approach was failing. Why did it take so long for Albertans to hear from him on this?
The Honourable Premier.
Mr. Speaker, 12 days ago, the government introduced additional restrictions to address the fall spike in cases. We indicated we would take time to see what impact they had. When it was clear that case counts continued to rise at a worrisome level, we then came forward with yesterday's strong and balanced package of additional public health measures that are designed to bend down the curve while minimizing broader social and economic and health damage, Mr. Speaker.
The Honourable Leader of the Opposition.
Mr. Speaker, Ontario closed restaurants, bars, nightclubs, gyms, casinos, movie theatres on October 9th, when their active cases were 5,600, or 0.4 per 1,000 of the population. As of yesterday, when we finally heard from the Premier, Alberta had more than 13,000 active cases. That's 3.2 per 1,000, or to put it another way, 8 times the infection rate of when Ontario took more action than this Premier did yesterday. Why did it take so long for this Premier to show up to work?
The Honourable Premier.
Mr. Speaker, I can assure the Honourable the Leader of the NDP that I have never left work. While I was in self-isolation at home, I was working all day, every day. This past weekend, I was speaking to frontline physicians and nurses to get their view on COVID on the front lines. Mr. Speaker, we worked for several days in developing yesterday's package. In fact, following an 8-hour cabinet meeting, because unlike the NDP, our approach is not an ideologically reflexive one to put hundreds of thousands of people out of work, but it's to balance the public health imperative with the broader health of our society.
The Order, the Honourable the Leader of the Opposition.
Quote, we must take action. Mr. Speaker, that's our CMO speaking before she brought her recommendations to Cabinet. Yet yesterday we saw the Premier announce the rules for bars and restaurants unchanged. These are the places where people get together in groups, well over 10 of them, indoors, without masks, and there are no new measures. This is the opposite of what we see in other provinces, almost all of which have far fewer cases than us. Is the Premier really trying to tell this Assembly that Dr. Hinshaw recommended they all stay open?
The Honourable Premier.
Mr. Speaker, the measures announced yesterday with respect to bars and restaurants are to limit service to family cohort groups, which is precisely the same policy of the NDP government in British Columbia. Mr. Speaker, I know the NDP doesn't like restaurant owners. They boycotted Restaurants Canada meetings. They used to trash restaurant owners when they were in government. They pushed hundreds of restaurants out of business. 40% of restaurants are saying now that they could not survive another shutdown. She wants to throw thousands of them out of business and tens of thousands of Albertans, and particularly women, out of jobs.
The Honourable Leader of the Opposition.
This Premier's failure to control the virus is what's going to cause the shutdown he claims to be so concerned about. Now, after the CMO made her recommendations, these guys went behind closed doors for over 10 hours to broker their deal. The outcome? An irrational mask policy that leaves Albertans, many of whom live in communities with alarming case rates, as the only Canadians without a mandatory mask rule. It's painfully obvious that medical advice is not what's driving the decision-making. Instead, the tail is wagging the dog, and that tail consists of his extremist, anti-science, anti-mask caucus members. To the Premier, why are you putting
The Honourable the Premier.
What we're seeing here on vivid display is the same approach that Alberta's NDP has taken to this public health crisis from day one, which is to see it as a political opportunity to do the only thing they know how to do, which is to attack, divide, and deceive. Mr. Speaker, it is irresponsible. They are panic mongers. All they seek to do is to inflame panic. We don't have a single COVID case in 2/3 of our hospitals. We've only seen 18 restaurant outbreaks out of 13,000 businesses, but she wants to punish 13,000 businesses and 175,000 workers instead of taking reasonable measures, Mr. Speaker.
The Leader of the Opposition.
His reasonable measures mean that we have the highest number of cases in the country, over 3 times that of Ontario. He is losing the fight. He's catering to his anti-science, anti-fact, anti-maskers in the caucus, and he's doing it at the expense of Albertans' health and safety. His members have said wearing masks drives the spread. They've said keeping kids safe at school is excessive risk aversion. Why are you letting these dangerous voices drown out what doctors, scientists, and health professionals are telling you, begging you to do?
The Honourable the Premier.
Mr. Speaker, when the NDP was parroting the World Health Organization and the Public Health Agency this spring, telling people not to wear masks, this government was advising people to wear masks. This was the first. Boy, Mr. Speaker, you know, she has so much respect for this place, she can't stop heckling. I can't remember. I was in Parliament for 19 years. I can't remember a leader heckling like that. It just shows they're addicted to division and panic. Mr. Speaker, this was the first provincial government to recommend mask usage, the only provincial government to provide tens of millions of free masks. There is now a mask mandate where 83% of cases are.
The Honourable the Leader of the Opposition.
The only provincial government without a provincial mask mandate. Now, this Premier told Albertans that he's locking down their homes because that's where most of the spread is coming from. But he doesn't know where the spread is coming from. No one does, because our contact tracing system has collapsed. We don't know the source of more than 85% of new cases, and if you got sick more than 10 days ago, we've given up trying to find out. Does the Premier not realize that his own failure to prepare for the second wave, to hire more tracers, means the very idea of targeted restrictions no longer applies?
The Honourable the Premier.
Mr. Speaker, you know, one of the fundamental truths about the NDP is they really don't like Alberta. They don't like to celebrate the fact that we've had the strongest contact tracing system in Canada, that we've had the highest per capita levels of testing, the best prepared with respect to personal protective equipment and ventilators, the first province to have an online assessment tool, the first province to have a contract tracing application, Mr. Speaker, and we continue with contract tracing. Like all other places, it's focused on priority populations, and of course we know where spread is coming based on hospitalizations, and we're putting the resources where they are most needed.
Leader of the Opposition.
What Alberta has is the highest per capita case growth. Now, the Premier's inaction broke Alberta's data collection system. We don't have data for 85% of new cases. He says people aren't exposed to the virus at restaurants and bars, but he has no evidence to back that up. Meanwhile, the CDC says restaurants and bars are a significant infection source, and other provinces with far fewer cases have restricted them. Premier, if you want to argue evidence, why are you ignoring what's happening in other jurisdictions, ignoring medical research, and pretending you have data which you don't?
The Honourable the Premier has the call.
Data. 18 outbreaks associated with 13,000 hospitality businesses since they reopened in June. That's 99.9% that were not associated with outbreaks. 1% of traceable cases over the past 9 months associated with restaurants, bars, and pubs. Mr. Speaker, in terms of following other provinces, why does the NDP have to politicize everything? Our policy approach here is almost identical to that of British Columbia, with a similar rise in cases under an NDP government with respect to restaurants and most other matters.
The Honourable the Leader of the Opposition.
BC has less than half the cases of Alberta and a significantly larger population, so we're nothing like them, Premier. Learn your file. The fact is that this province has no idea where things are because they don't have the data. What they do have are projections for case numbers, for hospital capacity, for ICU availability, all at his fingertips, along with other modeling. Albertans are demanding to know how he is making his decisions, with what information. Will he release that information, and if not, why not?
The Honourable the Premier.
Mr. Speaker, AHS uses its early warning metrics at all times to identify potential surges in need for capacity. So it's not modeling. Mr. Speaker, we did the modeling in the spring to see what the worst case scenario is, and we are prepared for it. We demonstrated that, for example, through ample supplies of personal protective equipment. With respect to British Columbia, yes, their case count is lower because their testing has been 1/3 of our level. Mr. Speaker, their velocity of case growth is similar to Alberta's, but why do we have more cases than BC? In large measure because we are testing at 3 times their rate.
Order. The Leader of the Official Opposition for her 4th set of questions.
We're testing too much. Thank you very much, Donald Trump. Quote, these measures might have worked a month ago, but they're too late to fix what's happening now. The shells are in the air. Mr. Speaker, that's ICU Dr. Darren Markland, who says beds are at capacity and doctors are 2 weeks away from triage. He compares the new measures to IKEA instructions, unclear and difficult to interpret. Doesn't the Premier realize that by continuing to delay and to avoid real action, he's making things more confusing and he's encouraging the spread of the virus?
The Honourable the Premier.
So let's be absolutely clear about what the NDP wants to do, Mr. Speaker. They want the government to essentially create a quasi-police state. They want us to shut down and destroy permanently tens of thousands of owner-operated businesses. They want us to throw hundreds of thousands of people into unemployment. They want us to do all of this, Mr. Speaker, because that's what they're socialists. They are addicted to command and control of people's lives. This government is focused on...
Order. I have no problem hearing the Leader of the Opposition's question. I often have problem hearing the Premier's answer. You might not like the answer, but he's entitled to give it. The Premier.
Mr. Speaker, what they want to do is to put hundreds of thousands of people out of work. What we've done is our strong and stringent measures that are focused. If they are insufficient, there will be additional measures.
Leader of the Opposition.
Let me be perfectly clear to this Premier. Your negligence is far, far more dangerous to our economy and the people who rely on their jobs than sound public health measures. Quote, we are in a car that's careening toward a cliff. We had a chance to turn the wheel or hit the brakes, and all we've done is taken our foot off the gas. Mr. Speaker, that's Calgary urgent care doctor, Dr. Raj Bhardwaj. He questions why we're not doing more. He questions why masks still aren't mandatory. Premier, can you explain why you are ignoring so many doctors who are begging you to finally take real action?
The Honourable the Premier.
Mr. Speaker, while the Leader of the NDP seems obsessed with telling some guy working in a barn 400 kilometers from a major population center that he has to wear a mask, our focus is on actually preventing major vectors of transmission based on data. And the single largest one of those, Mr. Speaker, is social activity, particularly private at-home social activities, which based on, yes, we do know it, based on 9 months of data with the most robust contract tracing system in Canada, is associated with at-home social activities, which we banned yesterday in an extraordinary exercise of state authority.
The Honourable the Leader of the Opposition.
Mr. Speaker, the Premier is continuing his discredited libertarian approach of pitting the economy against the health of Albertans, and he's going to sacrifice both as a result. He's been MIA for 12 days. His inaction has cost us all our data, which we don't have. He's refused to look at other provinces' best practices. He's catering to the anti-maskers in his caucus. He's not listening to doctors, and I suspect he's not listening to key public officials advising him. Quite frankly, yesterday looked like a declaration of giving up. Why is he working so hard to let Albertans down?
The Honourable the Premier.
Mr. Speaker, when the member says we don't have data, we have 9 months of accumulated contact tracing data. We have, Mr. Speaker, she just accused this government of taking an extreme libertarian position when for the first time in the history of this province, yesterday, we made it illegal to visit people's homes. Only the NDP could consider that an extreme libertarian position, Mr. Speaker. Here's the problem. Their first resort is to totally demolish constitutionally protected rights and freedoms. We believe that should be a last and limited resort.